Hello, everyone. Welcome to Lee County Literacy Coalition Health Literacy Program. This is the second session of our pharmacy series. Our first session talked about what a pharmacist can do for you. If you haven't listened to the first session, you definitely should. This session is called The Importance of Immunizations. Hi, my name is Kaylin Sandoval, and I'm a pharmacy student at Auburn University. First, I'm going to talk to you about why it's important to get your flu shot as well as other immunizations. Vaccines, also called immunizations, are very important because they keep you and others from getting certain illnesses. When you are a child, there are many vaccines that you need to get, but these will be given to you when you go to your doctor's appointments. There are some vaccines that you need when you are older, and you can get these at your pharmacy. There are a lot of vaccines that your pharmacy may provide to you. Some of these include a vaccine for tetanus, diphtheria, whooping cough, meningitis, pneumonia, chickenpox, HPV, hepatitis A, hepatitis B, measles, mumps, rubella, polio, and shingles. You should always talk with your doctor or pharmacist about which vaccines you need to get. There are certain vaccines you need based on your age, where you live, or who you are around. It can be very overwhelming to know which vaccines you need, so never be afraid to ask your doctor or pharmacist what they recommend. Now I'm going to talk a little bit about the flu shot. The flu shot is also referred to as the influenza vaccine. So you may also hear people say that when they're talking about the flu shot. The flu shot is important to get to keep you from getting the flu. The flu is a contagious respiratory virus that can infect your nose, your throat, and even your lungs. It can cause fever, muscle aches, severe sickness, and patients even die from it. The best way to prevent the flu is to get the flu shot every single year. Usually the best time to get the flu shot is in the beginning of the fall, right before flu season normally starts. People commonly think that you can get the flu from the flu shot, but that is not true. When you get the flu shot, you are injecting a dead flu virus into your body so that your body can learn to fight off the live virus. You cannot get the flu from the injection. Another thing that people commonly wonder is, why do you have to get the flu shot every single year? Every year, the flu virus tries to change a little bit so that way it can better get into your body to make you sick. Researchers work very hard during the year to figure out how the flu virus will change and which viruses are going to be spreading so that they can make a flu shot that will fight those specific viruses. When you get the flu shot, you're going to be immune from the most common flu viruses for that season. So if there's a different type of flu virus, you could still get the flu. The flu shot is still the best way to prevent the flu because it is the most common types of flu that are around that year. After you get the flu shot, there are other things you can do to keep yourself from getting sick. The flu spreads to other people through little droplets that come out when talking, coughing, sneezing, blowing your nose, or other things. It can spread just by touching a surface that someone else left those little droplets on by accident. Some things that you can do to stop the spread of the flu are: 1. Always wash your hands with soap and water whenever you can. 2. Cover your coughing or sneezing in order to keep those droplets from spreading to others. 3. Stay home when you feel sick. You do not want to spread it to others. 4. Do not share cups with other people and do not eat after other people. And 5. Get the flu shot. Getting the flu shot should be quick and easy. You don't just have to go to your doctor to get it. Most local pharmacies carry it and can give it to you in their store. Call your pharmacy before you go to ask if it is available, and you can even ask what your cost will be. Most insurance companies will completely cover the cost of your flu shot. If you don't have insurance, ask your pharmacist other ways to get a discount. Pharmacies even give you incentives to get the flu shot. For example, Publix gives you a $10 gift card and CVS gives you a $5 off coupon. So visit your pharmacy today to get your flu shot. If you have any more questions about the flu shot, please ask your doctor or your pharmacist, because what do pharmacists want to do for you? Pharmacists want to help you. They work day in and day out to help in any way they can. The main thing they want is to see a smile on all of their patients' faces, including you. Thank you for watching. And again, if you have not seen the first session on what your pharmacist can do for you, you should go watch that next. You can find our next session in our pharmacy series at www.leecounty.literacy.org in January 2020. The information on this webinar is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this webinar is for general information purposes only. Never disregard professional medical advice or delay seeking medical treatment because of something you have read or accessed through this webinar. If you have any questions about the topics in this webinar, be sure to call and ask your pharmacist or doctor. If you have any questions about our programs, email info@leecounty.literacy.org or call 334-705-0001.